True or false? You don't need to swab the diaphragm once I pop this cap off. Hello, my name is Bridget. I'm a family nurse practitioner. In today's video, I'll be going over if once you pop this cap, if you need to swab this diaphragm with alcohol in order to disinfect it. The reason why I'm doing this video is because I was once precepting a graduate nurse or a GN, and she had popped it off. She was about to insert that blunt needle to withdraw the medication. And I told her, let's call her Susie Q. I said, Susie Q, you haven't swabbed the diaphragm yet. She's like, I don't need to swab it. It's sterile. That has stayed with me for a while. Our patients come to us in order to get better. I'm very passionate about providing the best care possible to our patients, keeping them safe and preventing any bloodstream infections. So like I said, education is my passion, and keeping patients safe is also extremely important to me. I have Sjogren's, which is an autoimmune condition. I've had my share of health issues. So I have been both a nurse, but I've also been a patient. And I've been a patient where there was breaches in how the nurse, for example, wasn't swabbing my IV hub site. It could have potentially put me at danger for getting a bloodstream infection. So this is according to the Institute for Safe Medication Practices. And this is the version that was published in 2015. They have their guidelines. It says, practitioners may not be aware that pop-off vial caps from manufacturers are considered dust covers and are not intended to maintain sterility of the vial diaphragm or access point. Thus, the diaphragm must always be disinfected after removing the cap of a new vial. So how do you clean the top? Using friction and a sterile 70% isopropyl alcohol. So basically an alcohol swab that we have at the hospital. It says here it's important to wait at least 10 seconds to allow the diaphragm to dry before inserting any device into the vial or accessing the medication. And some places even say waiting as long as 15 to 20 seconds. It's important to let it dry. And again, the important thing is to use friction. You shouldn't just be delicately swabbing the diaphragm. You need to use friction. So this is according to the Spine Intervention Society, and myth, swabbing of vial tops is unnecessary. The 2010 American Society of Anesthesiology guidelines support swabbing vial tops. Disinfect IV ports and vial stoppers, friction with a 70% isopropyl alcohol, ethanol alcohol. Allow the port to dry before accessing. Previous to this, the World Health Organization had said it was not necessary, but they're finding that it is important to do. The other important thing I wanted to point out is that the World Health Organization points to several instances of spread of infection after vial swabbing, including an instance of pyogenic abscesses after alcohol swabbing of vaccine vials. In these instances, the spread of infection involved cotton swabs in a jar, not single-use sterile disposable alcohol swabs. So in 2010, the World Health Organization recommended swabbing vial tops with 60 to 70% alcohol when preparing injections is best practice for injection-related procedures toolkit. Recent evidence shows that the vial dust caps may not contain sterility of vial tops. After either routine handling, exposure to aerosolized E. coli, 2 of the 12 vials in the routine handling group were found to have microbial contaminants. So it's important, the conclusions and the recommendations is to make sure that you swab all vials with alcohol, single-use swab, but on top of that, do not use cotton swabs in a jar. I used to get allergy shots, and when I would go, the person that was giving me the vaccines had a huge jar filled with cotton swabs, and they were all wet and soaked with alcohol. And she would take one swab from the jar, she would wipe the back of my arm, and she would inject me. So according to this, that is not good practice. Like it said earlier, there were instances where people developed abscesses because they were using these cotton swabs that were soaked in alcohol. Remember, we introduce things, if it's not packaged and sterile, once we open it, it's really hard to keep things sterile once we've opened something. So just a jar sitting there like simmering full of cotton, reaching in, you could potentially expose it to bacteria, etc. So if you are a nurse, that's also, maybe you've seen this being done. Unfortunately, this was done at a practice where I was working at, where this was what the physician would do. He would have cotton swabs in a jar. So make sure you let your physicians know, or if you're a physician watching this, or if you're a nurse, that, please pass this on. If you are in the education setting, please teach your nursing students to swab the top of vials in order to prevent the spread of infection. I'm very passionate about this. It's important for us to not make our patients sicker when they come to see us. They trust us with their healthcare. So I wanted to share this article showing the consequences. As a nurse, what you do matters. If you're in the healthcare field, your job matters. You make a difference. So in the United States, bloodstream infections are very costly. And we'll talk about costs, but it's also costly for the patient. So it's costly to healthcare. It's estimated in the United States that catheters can introduce infection to the bloodstream, and ranging from $670 million to $2.68 billion annually. This article was talking about both peripheral IVs and PICC lines, so it talked about everything. These infections are associated with increased length of hospital stay from 10 to 20 days and increases in the cost of care from $4,000 to $56,000. Imagine you're a patient and imagine you have to stay in the hospital extra days because you got a bloodstream infection, and now instead of 10 days in the hospital, you have to stay 20 days. And imagine once you get discharged, opening up a bill and you owe the hospital $56,000. So I will leave you with that. Like I said, if you're in healthcare, your job matters. Everything you do has consequences, whether for good or for bad. So please practice best practices. Wash your hands, swab hubs, IV hubs, port sites, vial tops, etc. There's no shame if you didn't know and you were taught that a vial top was sterile. There's no shame. Like, there's no reason for you to be ashamed. I'm not doing this to shame anybody. I'm doing this to educate. Medicine changes constantly. Please share with your fellow nurses. And as long as once you learn, as long as you change your practice to the latest, best evidence practice, that's what medicine is all about. We make studies and we learn from them. If you found value in this video, make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell.